My name is Lynette McLaughlin. I'm a registered nurse. I'm going to complete a periphery exam. Liam has agreed to be my student. Liam, are you okay with this videotape getting sent to all of it as a reading electronically?
Yes.
Thank you for allowing me to videotape you. I'm going to scan the room. And I'm going to show my note card to begin the assessment. I'm going to wash my hands. The assessment is going to begin with inspection of palpation of Liam's upper extremities. I'm going to palpate the joints of his fingers. I'm then going to inspect and palpate his wrists. I'm going to move into his elbows and his shoulders. As I'm palpating and inspecting, I'm noting the color, the temperature. He has pink skin. His skin is warm and dry. There's no lesions, no bruising to be concerned about. I'm going to check his capillary refills. Liam has a brisk capillary refill. I'm going to go ahead and assess his radial pulses. His radial pulses are 2+ bilaterally. Okay, we're going to assess Liam's range of motion beginning with his fingers. Liam, if you could go ahead and flex your fingers, extend your fingers, hyperextend your fingers, abduct, adduct, and perform thumb opposition. As I'm doing the range of motion assessments, I'm looking to see that these are completed without pain or pause to ensure a normal exam. Okay, the wrists, Liam, flex, extend, hyperextend, abduct, adduct, and perform circular motion. Okay, with the elbows, flex, extend, hyperextend, and go ahead and make circular motion. Okay, the next range of motion will be on the shoulders, Liam. So if you can flex your shoulders, okay, extend your shoulders, hyperextend your shoulders. Go ahead and give me an internal rotation, external rotation, abduction, adduction, and again circular. Okay, I'm looking for, again, Liam to perform these tasks without pain or pause. Liam, if you can go ahead and grip my fingers. I'm looking for an equal grip, and Liam does have an equal grip bilaterally. Okay, I'm going to check Liam's strength of his biceps and triceps. Liam, if you can go ahead and bring yourself in, go ahead and push against my hands and pull against my hands. To check the strength of Liam's shoulders, go ahead and push downward and go ahead and push upward. Again, I'm noting that Liam has equal strength bilaterally in his shoulders. Okay, the next test is for light touch. Just tell me if you can feel that, Liam.
Yeah. Yeah. Mm-hmm. Yeah.
Okay. I'm now going to ask you if it feels the same or feels different.
Same. Different. Different. Same. Same.
Thank you, Liam. I'm going to check for sterogenesis and graphesthesia. I'm going to place an object in each hand, Liam. You just tell me what it is.
Keys. A pen.
To check for graphesthesia, I'm going to draw a number in each hand. Go ahead and close your eyes. Tell me what this is.
7 and 2.
Thank you, Liam. I'm going to check his vibratory sensation over the proximal ulnar prominence. Okay, Liam? Can you feel that?
Yeah. No.
Okay.
Yeah. No. Yeah. No. Yeah. No.
Okay, thank you, Liam. The next test is going to check for cerebellar coordination. I'm going to ask Liam to perform some tasks. Go ahead and shake your wrists, tap your fingers, make the OK sign, and do some hand foot flex. Okay, thank you, Liam. I'm going to perform deep tendon reflexes, and I'm going to start with the brachioradialis. So go ahead and rest. And I'm going to look for the thumb motion. This would be the bicep okay? And the Achilles. Okay, and again, the brachioradialis. Okay? And the bicep. The tricep. Okay? The patellar. And the Achilles. Thank you. We're now going to move on to the lower extremity assessment. Liam, if you could take your socks off for me, please. I'm going to begin with the assessment of the toes. So again, as I'm assessing the toes, I am checking the range of motion of his toes. I'm also looking at the color and the temperature of his feet and his legs, all the way up into his hips. Liam has a brisk capillary refill, bilateral feet. Okay, we're going to go ahead and assess the ankles. Again, free of nodules, crepitus, pain, tenderness on the ankles and the toes. All right, Liam, we're gonna do an ankle assessment now for range of motion. I'm gonna ask you to go ahead and perform dorsal flexion, bring your feet up, looking for the ankles without pain or pause. Plantar flexion, go downward, bring your ankles in, that's inversion. Extend them outward, okay? That's eversion. Go ahead and rotate your ankles. Good, okay. I'm going to check for pedal pulses. Liam has brisk pedal pulses, and I'm going to check for the posterior tibialis pulse bilaterally as well. And again, I can feel a brisk pulse bilaterally. Okay. I'm going to go ahead and check the strength of your ankles. Go ahead and bend upward, dorsal extension upward against me, and go ahead and push downward. Okay, good. We're going to go ahead and move into the knees. I'm going to palpate the knees. Again, as I palpate the knees, I'm looking for any pain, crepitus, nodules, tenderness. They appear symmetrical bilaterally. As I go ahead and assess the hips, again, looking for any obvious signs of pain, any crepitus, nodules, not feeling anything. We're going to go ahead and test the strength of the knees. Go ahead and push, give inward against some resistance, and go ahead and outward, push upward. Again, with the hips, push inward, and go ahead and push outward. Okay. Thank you, Liam. Again, can you feel that?
Yeah.
This again is assessing for light touch.
Yeah.
I want to make sure
Yep.
he has a normal, adequate sensory response.
Mm-hmm.
Okay? Is this the same or different?
Same. Different. Different. Same.
Okay, thank you, Liam. I'm going to go ahead and check the vibration of the medial malleolus.
Yeah. No. Yeah. No.
Thank you, Liam. Okay. I'm going to ask Liam to lay down, and we're going to continue the assessment. We're going to check the hips. Yep, go ahead and lay down and relax, and lay your legs out straight for me, Liam. Okay. To do the hip range of motion, I'm going to ask you to bring your hips up, your legs up. This would be hip flexion. Now I'm going to ask you to raise your butt a little bit off the bed. This is extension, up a little higher. Hyperextension. Again, I'm watching that Liam does this without pain or pause. Go ahead and bring your legs out for me and make circular motions. This is hip circumduction. Okay, thank you. I'm going to go ahead now and do some range of motion with Liam. This would be adduction and abduction, internal rotation and external rotation. Okay. Adduction, adduction, internal rotation, and external rotation. I'm going to check range of motion of his knees bilaterally. If you can go ahead and tent your knees, bring them up into a triangle. This is what we call knee flexion. I'm going to go ahead and ask him to extend his knees out. This is knee extension. I'm going to lift Liam's legs. This is going to be knee hyperextension. What I'm looking for is a clean, smooth line when I hyperextend. Thank you, Liam. If I can have you, Liam, turn over and face the couch, I'm going to look at your spine. Again, I'm going to palpate the spine, noting for any tenderness, any nodules, any crepitus. Thank you. Okay, then I'm going to ask you to stand up. We're going to perform some range of motion of the spine now. As I do this, I'm going to support Liam. Okay, Liam, go ahead and bend forward. This is spinal flexion. Go ahead and stand up and just a little slightly back. This is extension. Back a little more. This is hyperextension. Go ahead and stop for a minute. I'm going to ask you to bend from side to side. This is lateral flexion of his spine. Again, I'm watching Liam do it without pain or pause. And go ahead and just rotate on that spinal rotation. All right, I'm going to have you face this way, Liam. Bend forward just a little bit. I'm looking at the curvature of the spine. Any significant curvature would be concerning for scoliosis, but this is a normal assessment. All right, Liam. If you can go ahead and turn around. I'm going to ask you to perform a Romberg test. Go ahead and close your eyes and bring your hands up. As I'm watching Liam, his eyes are closed. He has excellent balance. He's negative for a Romberg. Okay, Liam, go ahead and walk 3 steps. Normal gait, come back. Okay, and I'm going to have you do some more steps for me. Go heel to toe. All right, and thank you, Liam. And if you can just hop on each foot, one at a time, and then together. Okay, this concludes the exam. Thank you.